Welcome to the Confident Smile Podcast, where we talk with the leading experts on how to treat dental issues and get healthy gums and a beautiful smile. With your host, Dr. William Levine, a periodontist of 35 years and chief scientist at PeriActive, a trailblazer in oral care. PeriActive is clinically proven to reduce inflammation and promote gum healing within 60 days.
Well, I'd like to welcome as our guest today, Dr. Michael Goldberg. Dr. Michael Goldberg is the dentist-in-chief of Sinai Health and an associate professor in periodontics at the University of Toronto. In addition to that, he's the director of the Center for the Advanced Dental Research Care and Implant Monitoring Unit in Mount Sinai Hospital in Toronto. So, Michael, thank you very much for joining us on this podcast today. And our topic, as we discussed, will be peri-implantitis. Just to introduce our listeners to the concept here, there's been a lot of talk in the media about the problems that people are having long-term with infections around implants and possibly loss of implants downstream after they've been successfully placed. So perhaps explain to us a little bit about the problem of peri-implantitis and maybe its impact on the world of dentistry and overall health. Okay.
Thank you. Well, thank you for having me, Bill. I really do appreciate talking about this particular subject, which is very close to my heart. And as you have noted in my intro, that it is a clinic associated with a clinic that I do monitor and manage, both at the University of Toronto as well as at Sinai Health. And the problem with peri-implantitis is something that I think if you look at the literature, it's been known for many years that implants do have problems, but it's never really been introduced by the dental community. You know, we talk about the success of placement of implants, how well they do in terms of their restoration. But I think one of the big problems is understanding the fact that implants have to be maintained. And a lot of the time we have situations whereby infections can develop. And peri-implantitis is basically a bacterially introduced infection that creates inflammation around an implant and ultimately leads to the loss of bone and the supporting tissues. And from that perspective, it is a growing problem given the fact that more and more dental implants are being placed. The problem with it is the fact that it's not something that necessarily happens immediately. Patients will kind of have their implants placed, they'll have the restorations done, and then life will go on. And, you know, depending on how the dentist introduces the whole concept of implant dentistry to the patients, some patients will be very meticulous with their home care and their professional care. And other people sometimes will just say, well, I've got a piece of metal in my mouth, not like a tooth, I don't have to worry about it. And ultimately, if bacteria is allowed to collect and inflammation is allowed to develop, we ultimately have a problem that can develop with dental implants. So, you know, they're far from something that you kind of place and forget about. It requires a lot of management and a lot of maintenance. And as they say, the more implants that are being placed, the bigger the problem it's becoming worldwide.
We know that there are literally millions of dental implants being placed annually. And it's become a very common and standard part of regular dental practice. So first of all, yes, it's a problem, but how impacting is this problem? Is there any estimate as to the percentage of people who have implants placed who will suffer from peri-implantitis?
Yeah, the problem, you know, when you look at the studies is that some of the bigger studies that looked at multiple years of implant therapy go back to a time where they were studying implants that are not really used these days. And the other thing is that the definition of peri-implantitis was really something that varied from study to study. So people didn't really get a firm grasp of the situation from a definitional standpoint. Back in 2017, the American Academy of Periodontology and the European Federation of Periodontology had a consensus conference where they actually were able to define not only what peri-implant disease is, but also what peri-implant health is. And it at least helped in terms of more current studies with respect to determining how much of a problem this is. Now, peri-implant diseases do tend to cluster in the sense that people that do have a problem with one implant oftentimes do have problems with multiple implants. So numbers are sometimes difficult to determine, but many of the studies I've looked at recently suggest that maybe about 20% of implants can be affected by this particular problem. And that's a pretty significant number. You're talking about 1 in 5 implants that go into place potentially have a problem, and it requires treatment. You're talking about expensive treatments, and in some cases, you're talking about treatments that cannot necessarily be reversed in terms of the disease process, to the point where implants either are lost or have to be removed because of the fact that they're creating a situation where it makes it difficult for patients to eat. They have discomfort. It's difficult for them to maintain. The tissue bleeds. So you've got all of these potential problems that can interfere with the daily activities of an implant-based patient.
And you're sitting in an academic position, and you're really looking at a lot of different dentists in their training program, but also a lot of different dentists who are possibly faculty professors or who work in the same city or in the general area. Do you feel that dentists adequately prepare their patients for this risk factor, or they're basically saying, we'll place an implant and not giving them all the information? Because oftentimes it's a decision for the dentist. Do I try to save the tooth, or do I place an implant? And if the patient knows all the facts, they may make a different decision. So I'm curious as to your feedback about that.
Yeah, well, you mentioned about my position in an academic realm. Hopefully one of the things that I convey to my residents is the very issue that you brought up, the fact that not only do you just simply talk about the nuts and bolts of how you place the implant, but the long-term management strategies, and the fact that these are problems that develop, again, not necessarily within 6 months or a year of implant placement, but sometimes 8 and 10 years down the road. And truly, I don't know whether patients are fully informed of the potential ramifications of this particular problem, the incidence of the problem, and how to maybe go about preventing this particular problem from happening. And that, I think, is probably one of the big things that is lacking in terms of, where courses are given on the weekend to learn how to place an implant. The placement of the implant is a very mechanical process, but how you go about managing the patient and the implant situation, as I say, 5 years, 8 years, 10 years down the road is very important. And so one of the things that we do stress in our patient population, both in my private practice as well as in the academic world, is a proper maintenance program. And oftentimes that includes, regular scaling and root planing, making sure that the implant is properly cleaned, and using adjunctive therapies. And, oftentimes we do recommend the use of PeriActive as one of the adjunctive therapies to help to reduce inflammation before it sets in, to use it as much as a preventative approach to minimize the risk of these disease processes beginning.
A whole bunch of questions I'd like to sort of go on to, but what about any of your patients then, therefore, who have an implant placed, would you recommend as part of the process a daily use of PeriActive, or you feel like it's just therapeutic?
No, I think a daily use of it, and I use this not only to help reduce the inflammation around around implants, but around obviously periodontally compromised teeth, or again from a preventive standpoint. I think that there is an indication for daily use of the of PeriActive, as I say, as much as a part of a preventative protocol as anything. So we definitely advocate daily use for the rinse.
So let me sort of skate over a little bit of thin ice here. Being that I'm also a periodontist, I see different peri-implantitis types of cases. One of them is where the implant was poorly placed in its location, and it forced the dentist to do sort of dental gymnastics in order to restore it. And that in itself may be a cause for a significant number of the peri-implantitis cases that we're seeing. I'm curious as to your feedback on that, because our listeners will want to know, well, how do I know my dentist is going to place the implant properly? And if it's such a mechanical process, maybe anybody can do it. So maybe shed a little light on that topic.
Yeah, I think that's part of one of the problems that we do have, is that you have people that are maybe not as well trained in terms of the planning process. Myself, I use a lot of digital planning, so this way I am able to do a lot of the planning on a computer based with a computer generated guide that will give me an idea of exactly where the implant is going to go prior to the patient even coming into place. So I'm prepared for the fact that if there are going to be areas where I may have to compromise in terms of the positioning, I'm aware of it, and I'm prepared to manage it. And unfortunately, a lot of the training doesn't necessarily involve such a thing. So your mention of the, I guess for lack of a better term, the iatrogenic causes of peri-implantitis is a big problem as well. Not that I want to knock my university, but we sometimes see that in learners that are basically learning to place implants. They're happy that the implant goes in, they're happy that the implant integrates, but if you've got it either malpositioned, that's going to create a problem with the restoration, or you have a situation where part of the bone is going to thin out because of the fact that the implant is poorly placed, that is in and of itself another indication of a problem. And sometimes you have to manage those things, whether you like it or not. The patient, again, has paid the same amount of money, whether the implant has been placed well or placed poorly. So yeah, you are right that sometimes the gymnastics that we have to do, especially when it's not our implant, in terms of maybe trying to protect, so to speak, the practitioner, maybe a little bit of a problem. But yeah, those are one of the big problems that we do see, that you do have again, iatrogenic problems, poor restorations, improperly placed implants, be it a buccolingual type of displacement or an angulation problem, all of which can contribute to these problems. So kind of getting onto a little bit of a different subject, that's why I oftentimes, or I virtually always will plan my cases such that I'm using a more of a computer generated guided type of approach, whereby I'm actually able to really, in a good way, precision place the implant to try to minimize those risks of problems down the road. But it's not something we like to talk about. So as you said, skating on thin ice is probably
But I think
an
it's an
apropos
important topic
term.
for listeners to know.
Absolutely.
Be selective as to who places your implant and who restores it. So
Absolutely. And you can always ask patients can always ask their practitioner to show cases. Most practitioners these days, first of all, we all are taking x-rays of our implants, and most practitioners are taking photographs of their implants in terms of the clinical presentation. So a prudent patient, if there is a concern, based on the experience level and where the individual was educated in terms of their process, and this is something that you can easily ask to be shown a little bit of a slideshow before you make the ultimate decision of engaging with a certain practitioner.
So we've talked a little bit about the incidence and the problem and the causes. What do you do to treat peri-implantitis, and what's available to the patient? Because everybody who's invested in the surgical experience and the financial cost of placing an implant would certainly like to have it last as long as possible. So what's available to the patients in terms of, okay, they've developed peri-implantitis, now what?
Mm-hmm. Yeah. So, as I alluded to at the beginning, we've kind of got a two-pronged attack here on the implant. We've got a bacterial trigger to the process that creates that inflammatory reaction. And so we oftentimes have to deal with the infective process. And that was, one of the elements that came out of the consensus conference, is that there was some, some determination that it is an infected base problem. And so from that perspective, in many cases, systemic antibiotics are used. I do use local delivery antibiotics. I tend to take a conservative approach with managing peri-implantitis, at least as an initial foray into treating these conditions. So I will put local anesthetic around the affected implant. I will curette the inflamed tissue. I will oftentimes use a local delivery antibiotic in order to help to, again, reduce the bacterial load. I do have to say, in many of my cases, that is sufficient in terms of managing the situation. It's not uncommon that 2 or 3 years down the road, as the bacteria reaccumulates, as the inflammation returns, it may be a process that has to be repeated. If it's something that is the curettage and local delivery antibiotic, for all intents and purposes, is a fairly benign process, patients are not necessarily as concerned about repeating it. But there are situations whereby I do feel, based on the extent of bone loss and the potential frequency of recurrence of problems, that we do have to get into surgical therapies. With respect to the surgical therapy, it does involve opening up the gum tissue, cleaning up the defect, and in some way trying to regrow or regenerate some of the lost bone attachment. Now, whether the bone actually reintegrates with the implant or whether it really just becomes a barrier, as you know, as my fellow periodontist, it's very difficult to grow bone around these particular fixtures or around teeth. So from that perspective, I don't necessarily go into these procedures lightly. Again, they are costly. You're talking about a lot of materials that are involved with it. And again, you're talking about a surgical procedure that, the minute that you mention that word, patients' eyes tend to glaze over. They're not necessarily happy about having to do more surgery on a particular a particular problem like this. So as I say, management is a challenge, because even the surgical process of trying to regrow bone around an implant, or at least repair the defect, is not a predictable process in 100% of cases. So unfortunately, those are the situations where if unfortunately it doesn't work out as well, removal and replacement of the implant may be the best move forward.
So I'm going to try to capture and summarize all the valuable information you've given us, because we've covered a lot of ground. And then I want you to step in and sort of maybe correct my misunderstandings. Implants are pretty successful, but they need to be placed by the right person with a good and precise training in that area. A certain percentage of implants will develop peri-implantitis. That percentage will drop if the patient uses a proper maintenance program, and it's built in from the very beginning to prevent this problem. But when it does develop, there are some methods for treatment. We would rather not need to do that, but we sometimes have no choice. And we're pretty good at what we do to repair and maintain them, even when they've suffered from a certain level of peri-implantitis.
I think you summarized it perfectly. There's nothing to correct there.
I've heard peri-implantitis described as the tsunami of oral disease that's coming up. And I think part of that fear may be coming from the fact that, as you noted earlier, dentists are not really giving their patients the warning that they need, that there may be some problems with this downstream. But I do appreciate your sharing with us that you use PeriActive as part of the preventive program. Maybe share with the listeners, though, just as really a final statement, what about PeriActive is it that you like in terms of implant maintenance that differentiates it from other rinses?
Well, I think the biggest thing is that it's a non-alcohol based rinse. It's a natural product. The fact that it has some products that do have natural anti-inflammatory capabilities. It has echinacea, other types of properties that I think make it a little bit more acceptable than the conventional rinses that you see on the market today. And as I said, the literature that has been produced does show that the marked reduction in inflammation is my biggest pro with all of this. And it tastes good too. So patients are not averse to using it. So it's not something that, like some other products that are on the market that tend to have a harshness to them, I think that it is much more well accepted, and patients are constantly asking about how they can go about purchasing the product. So from that perspective, I think it makes their gums feel, really good after treatment, whether, as I say, it's around an implant or around their natural teeth.
First of all, let me take this opportunity to thank you very much for, educating our public and our listeners on this really, really unknown topic, and a topic that I think is critical for patients who are, who are using implants, or being suggested that being treated with implants downstream. Dr. Goldberg, thank you very much. It's been a pleasure. And I'm sure everybody who's listened to this podcast is smarter and actually benefits from this. So thank you very much again for your time and for your erudition.
Well, thank you very much for having me, Bill. It's been great to chat with you. And, I look forward to continued growth of PeriActive use in the marketplace. And hopefully, this tsunami will be just a small little wave in the ocean when, we take a proper preventative approach and manage things a little bit more efficiently.
Well said. I couldn't agree with you more.
Thank you for tuning in to another enlightening episode of the Confident Smile podcast. Remember, your smile is your greatest asset, and taking care of your dental health is key to showcasing it with confidence. Stay tuned for more valuable insights, tips, and expert advice to help you achieve and maintain a healthy and beautiful smile. Until next time, keep smiling with confidence.